Okay, so this is the last lesson, and we're going to talk about prenatal care and checking the fetus. But to start off with, we're going to see two short video clips on some do's and don'ts of pregnancy. So watch this, and then we will fill out our notes on page 62 in our note packet. So you should have that out as well.
Expecting mothers have quite the responsibility, don't they?
What do you mean?
Well, they have to be careful what they eat and drink. They have to stay healthy. And smoking sure doesn't help. Well, what did you find out about the effects of nicotine on fetal development?
Well, nicotine is classified as a teratogen.
A what?
Means it causes congenital abnormalities.
So what does congenital mean?
Congenital means at birth. A teratogen causes physical defects in the embryo, and the defects are present when the baby is born.
Is there any other examples of teratogens?
Sure. Alcohol, drugs such as cocaine, some prescription drugs, and even diseases, like the German measles. They all cause serious side effects.
Like what?
Spontaneous abortions, premature births, mental retardation, and in some cases even growth problems, like being born without limbs.
What did you find out, Sandra?
Well, I read that 25 to 30% of pregnant women smoke.
Sure not doing the fetus any favors.
No kidding. There was also some research that shows that heavy smokers will deliver a premature baby twice as frequently as a non-smoker.
Although medical practitioners can do a lot more for premature babies nowadays.
Well, yeah, there are technologies available to help premature babies. But they weigh less than normal. And low birth weight is a common reason for death in newborns.
So how does smoking cause such a low birth weight?
Well, nicotine constricts the blood vessels in the uterus and therefore the placenta. And that means there's a lower blood volume to carry nutrients and oxygen to the embryo and the developing fetus.
There was some interesting information on drug use during pregnancy as well. See, in the past, the use of prescription and non-prescription drugs was common. Today, doctors recommend that pregnant women avoid all medication during the first trimester, unless there's a strong medical reason for taking drugs. Oh, what did you find out about alcohol?
Well, maternal alcoholism is thought to be the most common cause of mental retardation. I talked to a specialist and found out more about fetal alcohol syndrome.
Fetal alcohol syndrome is the end of a spectrum of damage received by a fetus as a result of exposure to alcohol prior to birth. That particular syndrome is made up of three elements. The first is central nervous system involvement, that in fact they have a smaller brain than some are not so affected. There's prenatal, that is before birth, and postnatal, after birth, retardation in their growth. They're small. And thirdly, that they have characteristic facial anomalies.
Why does alcohol have its greatest effects on the first trimester?
That's because it's really in the first trimester that the organs are forming. In the first 8 to 12 weeks, pretty well all of the important organs of the baby are formed, and then the task in the rest of the other second and third trimester is growth. So alcohol, like any of the other teratogens or things that will cause birth defects, have their impact largely in the first trimester.
It's amazing that a single fertilized egg cell can transform into the trillions of cells that comprise a human being. In our discussions of gestation and parturition, we've unraveled some of the mysteries of the events that occur before birth, and research continues to reveal even more. One thing is certain: the ideal environment for fetal development is one free of drugs and teratogenic agents. Good nutrition, appropriate exercise, and positive lifestyle choices all influence the healthy development of a fetus and baby.
Births are pretty miraculous events.
That's why we need to celebrate them.
Okay, so you should be on page 62 in your notes. So some things that we should not do when we are pregnant. And why? Well, we do not want to drink alcohol. And the why is alcohol can cause fetal alcohol syndrome. Better known as FAS. What's something good that we should do while we're pregnant and why? Well, eat healthy. I think you heard that at the very end. Eat healthy. Why? Proper nutrition will help with the development of a healthy baby. What's something else that we should not do? We should not smoke. Do not smoke or use nicotine. Why? It lessens the amount of oxygen. I'm going to put that as O2, oxygen in the blood. Which equals less energy being made via cellular respiration, which equals a lower birth weight. So something positive is exercise as appropriate. This increases the amount of O2 which equals more energy which equals healthier fetal growth / development. And we have two more. Do not use drugs. Drugs can cause a malformed baby. Or a drug-addicted baby. Sure, you've heard the expression crack baby, because the mother was on crack. And no risky behaviors. Some good things, regular checkups. And prenatal vitamins. To ensure that the baby is developing on track. And you should practice Kegel exercises and take a birthing class. Kegel exercises strengthen those muscles that you use like when you go to the bathroom. Like if you were urinating and you were to stop urinating in the middle of going, it's those muscles. So it's like squeezing a ball between your leg or just tightening your muscles, because that helps you when you're actually going through labor. Okay. So checking the fetus. When a woman is pregnant, doctors can use various techniques to check the health and the embryo of the fetus, and that's why it's important to go on your regular visits. So first is ultrasound, which uses sound waves to get an internal image of the fetus. It can also use this depending on how the baby is positioned to tell the sex or gender of the fetus. But mostly it can be used to determine or spot any physical abnormalities. Meaning defects. Next one is amniocentesis, and that's very important. If something was found to be unusual on the ultrasound, or even if the woman had other pregnancy risks, the doctor might perform an amniocentesis. So what happens is, using a needle and a syringe, doctors remove some of the amniotic fluid. And fetal cells in the fluid can be tested. The DNA in the cells is examined for chromosomal abnormalities. Such as Down syndrome, Klinefelter's, those that we learned about when we did the karyotyping. So the last one we need to talk about is a karyotype, which you already know what that is. It's basically a photograph of the chromosomes. So after performing an amniocentesis, the laboratory technicians create a karyotype using the DNA. So we already know it is a picture of the chromosomes. That can be analyzed for chromosomal abnormalities. Remember that an XY is a male and XX is a female. And we also learned a couple of other things which we can just, so when you have an extra sex chromosome, for example, XXY, that is Klinefelter's. And extra number 21 is Down's syndrome. An extra 18 is Edwards. Probably the only one that's like really probably important that you know for the regions is this one, extra 21. Okay, and that's it. Have a nice evening.